Hi everybody, welcome to another one of our Facebook Lives this evening. It's me, Esme, one of the CAM team, and we're joined by the lovely Dr. Caroline Ficker.
Hello.
Tonight's chat is a difficult one, I would say. We're talking about a really hard topic. So we're talking about end-of-life care and euthanasia, which I think is close to everybody's hearts. It's particularly difficult when you're the owner and it's your pet, but it is also difficult from us as a vet's point of view to go through and support you. So we just wanted to do a live tonight just to sort of tackle some of those topics and hopefully give some advice on how to deal with it and how to cope with things. I'm going to pass over to the lovely Caroline to explain what she does and why she's such an expert on this topic.
Oh, hello, my name's Caroline. So I'm a palliative care veterinarian, and I got into this field. It's really an emerging field, probably about 10 years ago. And I've been working in clinics, in small animal clinics, for half of my career. I'm originally from Melbourne, Australia. I came over to the UK, was working in clinics here in London, and I found myself in a situation where I was doing home visits for a short time, and that short time became a longer time. But also, whilst I was doing home visits, and initially they were home visits for everything from puppy kittens all the way through end-of-life care, so it was pretty much anything that you can do in a consult room. I'd found that where people were struggling with the most, where they really valued the having a home visit and the input was for the palliative, for the senior pets, but also the palliative and end-of-life care. At the time, I was doing a fair amount of studying in philosophy and medical ethics, and I came across a human palliative care physician, and we had a conversation, and that was in 2008, and no one was talking about palliative care in the veterinary world at that time. Certainly not here in the UK, and not in a formal way. And it's like one of those aha moments, and that was my aha moments. It's like, actually, this is what I need to do. So I've been pretty much doing that ever since. My home visiting service in London has been rebranded to, and I now call myself Pallivet, which better represents the services that I offer. So I do a lot of palliative end-of-life care, but also because of the nature of home visits, I do a lot of mobility consultations, and I think they're the ones, especially with big dogs, they're the ones where people struggle to get their dog to a vet, and they really value the home input. So that's how I also find myself being involved in a lot of mobility issues with dogs, and also the really, really difficult decision that clients are faced with is when the mobility reaches a particular point and making that decision for euthanasia, and that's really, really tough, and Esme and I will touch on that.
Absolutely. So I guess the first question we should ask is, what is palliative care? What do we mean by palliative care?
Okay, that's interesting. That's a great question, because I just take the term palliative care for granted, but there's a lot of, certainly a lot of the general public are not familiar with the term palliative care. So palliative care refers to the symptom control for animals with chronic chronic progressing or life-limiting illnesses. And that's where, certainly in the veterinary context, it's where further diagnostics or treatment are not sought or not possible. And we're actually aiming, the focus of our care is on comfort control for the animal. But one thing I want to really stress, that palliative care is not just the symptom control of these animals. The palliative care also involves support for the caregiver, the owner, and that is absolutely crucial. So to just send home an animal with them, we're also familiar with, non-steroidals or Remedal, and say, okay, your dog is now on palliative care, here's some tablets, and call us when it's time. That's not palliative care.
Yeah.
You need that ongoing monitoring, you need the ongoing support, ongoing evaluation of how things are going. And we all know that with mobility issues, it's more than just medications that we need. Medications, they play an important part, but there are other things which are just equally as important. So palliative care really, it's this more of a holistic, more of a totally integrated type of care where we address the symptoms, and the symptoms means that the signs that they're showing, the discomfort that they're showing, and these are with animals that have serious, advanced, chronic, or life-limiting, and that's terminal illnesses, and also support for the caregiver, the owners.
Yeah, and I think in the context of arthritis, it's a difficult one, isn't it? Because we're dealing with a disease that actually isn't life-threatening. So it's not life-threatening in the primary sense, but in a sense of quality of life it is. So you're not going to die because you've got arthritis, but you could get to the point where your life is just not a quality that would be nice to live through. And I think that's the hardest part of dealing with arthritic dogs, is that most of the time we have to make the decision. It's very, very unusual for a dog to pass away on its own accord through natural causes, which makes it a huge responsibility for the owner. So at what point do you tend to see these dogs with arthritis? Are they at very end stage arthritis, or do owners seek your help before that?
It's varied, very varied. So I'll have some people who will seek my services early on. They will either be referred to me or find me online, and they decide, right, we want home care from here on. And so I'll see them early on. And I love getting those pets early on. Really, really does make a difference for a vet if we see them early on. And also in the home environment, and Esme, you would know this as well, as you've done home visits. You do have done home visits as well. In the home environment, you can really see a lot more than goes on at a veterinary clinic. Also, at the veterinary clinic, we just see a snapshot of the pet, and often we'll see them on their worst day. In the home environment, many dogs are much more natural, more normal. You'll see how they get up, for example, on their floor surface, and a lot of things will instantly just spring out at you. It's like, So I will sometimes see them early on, and I see them from early on till when they're collapsed. And it'll either be the first big collapse for a big dog, or it will be after multiple collapses. So I'll often see them, I will see some patients just at the very end, and that's when they've had a successful relationship with their own vet, with managing the arthritis. And for some of these, they have very, very little input in veterinary input for their pet's declining mobility, and then a particular decline will happen, and they'll, after a conversation, some of those are euthanized, and either they're euthanized even that same day, or a short time after, if they are no longer responding to further medical and non-medical support.
Yeah. So I guess the most common question we get with Holly's Army, which is our owner support group on Facebook, is how do we know when the time is right? When we're talking about an arthritic dog with, let's say, no other health issues, but mobility is slowly declining, how can an owner start to decide whether we're getting to that point or not, that euthanasia is needed?
Well, I think there are so many factors that go into that, and it's not a moment in time, because we also know there are good days and bad days. Yeah. And I think there are many factors that go into it. So the factors will be the dog factors, and the ability. So you need, as a whether they're able to do, and in the medical term, they call it the activities of daily living. So they're our basic daily functions. The ability to be able to walk, to posture, to pee and poop, to be able to stand up, to turn around, to make themselves comfortable if they're feeling uncomfortable or just wanting get up. So they're, obviously though, but that and the degree to where those factors come into the that final end of life, really partly depends on the size of the dog, and I think that's quite, we understand that large dogs are, sadly, they're euthanized sooner than small dogs, and I think that's an obvious point. They also depend on whether the dog has any other mobility issues. We see a lot of dogs, if they are fortunate enough and they don't get cancer or organ failure, and they live into a very, very advanced age, and that's where the arthritis and the frailty is more likely to be debilitating. They may also have, for example, dementia. And so it depends on whether they have other issues as well. And they can certainly have other issues such as cancer or heart or various organ failure. Sometimes we'll be treating a dog for its arthritis, and then another illness comes along, because we're talking about, and these are especially in the more older they are, the more likely there are other illnesses that will come along. And then that comes and plays into it. But also, part of it is, how is a dog coping with their poorer mobility? Some dogs seem to cope better, some don't. And their ability to cope with it, how comfortable, how much pain, how good is a pain relief that we're giving. Also, and there are a lot of mobility aids, and I'm a big fan of them, and they make life easier for the dog and the owner. And then the other factor that comes into deciding when is time, that's the owner's factor. The owners, they have their own belief, what's called belief systems. So some owners are more comfortable with providing a continual high level of care, that's physical care for them, and attending to all their medical needs, and their daily activity needs. Others feel that, that they don't feel that that's right for them or their dog. And so those ones naturally will be sooner. And also, previous experiences play a huge, huge role in deciding when is time for the owner. Usually it's for the first time someone is caring for their pet that has a chronic long-term issue, and it's especially if it's slowly declining. They want to do everything, and which is very admirable, but it's really hard when you have a very slow decline to see, to kind of measure the difference. So what's so bad with today compared with yesterday, especially when they're still eating and don't have other issues. Whereas if someone's had experience for caring for a pet with, especially if it's with that illness or condition, and when they look back and they think in hindsight, we think, we just left it too late, they're more likely to euthanize sooner. So it's certainly not it's not at all easy to decide when is time. There are so many factors and I've just touched on a few of these factors that are all taken into account. Every case is an individual. We always take the owners, the owner, the caregiver, their perspective into account, and ultimately, as veterinarians, our primary concern is also the welfare of the animal. And for me, if an animal is feeling frustrated by its illness, if it has an illness that's in a lot of pain, but also with a lot of mobility issues, if they can't get up and they feel frustrated by that, that's an emotional distress, and that's something we need to also address, and we have conversations about that as well. What is emotional? It's not just a physical distress and pain. It's what is emotional distress, and what does it mean for the animal? What does it mean for this pet, for your pet? And can we help? And if we can't, that's a really, really big important factor, and it's just as important as pain.
Yeah, I mean, I think we discussed this before, you and I, that I'm very passionate about when you get an arthritic patient, I like to categorise what pain they're suffering, what types of pain, and I'm sure all the campers will be sick of me saying things like this, but anyway, I'm going to say it anyway. But I like to put them into inflammatory pain, soft tissue pain, neuropathic pain, and then the big one, which is the emotional, so the emotional suffering. And you've touched on this loads, that actually that's the most important one. So if we can manage all the others, but managing the emotional suffering is the hardest one. And if that's one's not being managed, then that's the one that really tells us that it's time. And I think it's hard, like you say, it's hard because you have these really great days, and then you might have a week of really bad days. You think, oh, is this it? And then so we've tried a new medication and they're responding to it and it's going well. So it is difficult because they're often not on a straight trajectory downhill. They're often sort of waving through good days and bad days and gradually going lower and lower in terms of quality of life. So I think it can be really, really difficult. I think you made a good point that there isn't necessarily a certain day that's the worst day. It just comes to a point, and I think most owners just get to a point where they know. They just know something isn't right.
My little kitty cat's coming indoors and he wants some attention. This is Leo. Hello. Say hello.
Hello. He's just
hey.
Talking about your lovely cat, I wondered if you could just share the story about your dog, because you've been through, through this whole scenario with your own arthritic pet.
I know, he's sweet. I know, and so right now. So my house dog was Bodie, and he was a border collie, and I have had him as a puppy. He came with me everywhere. He was my sidekick. He was always, when I was working in, sweetie, you can't do that. When I was working in clinics, he would always come with me to work, and he just went everywhere with me. When he became older and he had mobility issues, and so I was managing his mobility issues for actually quite a number of years, because they are they're slowly declining. So needed assistance probably for about 5 years, the last 5 years of his life, and he was coping. For most of that, he was coping, and we had mobility aids were the biggest. That was the biggest aid and help for him. Obviously, environmental. We had to modify the home, so the slippery floors were gone, and he was on medications. He also, at the ripe age of 16, he also had dementia, and so one of the biggest challenges was when, with his mobility, he found it increasingly difficult to stand up on his own. Now, once he was up, he could run, he was fine, but standing up was really hard for him. And so he needed help. And it was at that stage I came to know that he was becoming emotionally distressed by not being able to get up. And as all of us caregivers, we all learn how to. I think he's not going to go away, so please bear with me. He's not going to go. So it became clear that he was emotionally distressed. And when I was there, yes, I was saying that we know the language. We've got a communication with our pets. And I was able to just know that early signal, just a little whine, he needed help, the shifting of the body. So he was always there. But there was a time where, you're not always there. And I think in the end, it became more and more clear that it was time. Now, Bodhi had, at 16 and a half, he had his mobility issues. Still went to the park every day, though. He could run on flat. He had really impaired eyesight, really impaired hearing. He was essentially deaf by then. And he also had dementia, so he would often be confused. It was, and there, but he loved his food, and that was the hardest thing. He loved his food, and when I was with him all the time, he was emotionally content and happy. When I wasn't, he couldn't see, he couldn't hear, he couldn't get up, and he was, it was not fair. But having to make that decision was probably the most difficult time of my life, and I'll admit, like many people, I couldn't go through with it. He was still eating. Yeah. And I thought, it's time. I'm not going to let it go too long. So I bottled the day before. I'd scheduled it several days in advance, and I actually ended up having to close my work so I could be with him 24 hours, and then after a week, just gradually getting back to work. And it was a few weeks later, it was clear that it was time. But I did what and Bodhi was my first dog. Grown up with having family pets my whole life, but he was the first dog that I was responsible for. And I did the same thing that I see a lot of people go through, and I have that empathy for people when they say, I can't, because I was that person who did that. It was a few weeks later I realized that it was just not fair on him, and it was actually because he was emotionally not happy. He could, and that was because if he couldn't get up when he needed to, and together with his other health issues, he wasn't emotionally happy, and it was the emotional distress that was the reason I had to euthanize him.
Yeah, it's just always such a difficult decision to make. But I mean, maybe I'm biased because my area is in mobility, but I do feel that it's one of the hardest decisions to make. Having a mobility issue in a dog and deciding when the time is right, compared to when you're looking at something that's life-threatening like cancer or other conditions. They're all hard and it's always horrible. I think with mobility it creeps on so slowly, and the days all blend into one in terms of how bad things are. It makes making that end decision tough. And I think also a bit of it, you have to take into account how you're coping with looking after that pet. I'm lucky, my dogs are tiny, so really they're handbag dogs. So when they get old, I can carry them, but you've got a Great Dane, you're not going to be able to carry them around. And I think sometimes the guilt from the owners is that they feel they haven't done enough, which I don't agree with. I think that they've often done loads and loads and loads of their pets. But I think you always hang on to the hope that there's something else out there that you can do, and there isn't always, or even if there is, it's not necessarily the right decision for that pet. And I think it's really tough. We've got a few comments, so I just thought we could just quickly talk through a few. We've got a couple of people listening from abroad. We've got someone from Canada and someone from South Africa, so welcome and thanks for joining. Francesca, I'm just going to summarise her comment, but she's facing a really difficult decision at the moment with her Samoyed 10-year-old dog. He has a tumour on the end of his penis, and the only way forward is full amputation. He has clotting issues and slow healing with severe arthritis, so they've decided against surgery, and at the moment he's bleeding a lot from the mass but is on painkillers, and they're in that really difficult situation of monitoring him and seeing how things go. And do you have any advice for her?
Well, the advice would be to stay in contact with your veterinary surgeon, really develop that relationship. And even if you see if you can, because especially now we're able, more and more vets are using the video consultations to have a quality of life consultation with your vet, and even, which I'm sure you probably have already had. And so from the health aspects, obviously being in regular touch with your vet, but also there is look at your support network, the human support network. And some people, they know, who are the people that they can turn to and who are the ones that they can't. But gosh, Francesca, that's a really, really difficult decision, because, and often we will see, for example, there are often tumors that are bleeding. So the tumor, it may be, regardless of the level of pain from that tumor, the bleeding becomes a practical issue, and that's for many tumors. And so they often signal the reason, the need for the euthanasia. And even though as difficult as that is, it's a tough one.
Yeah, it's so difficult, isn't it? Eileen's asking who you receive the majority of your referrals from. Is it from vets all over London?
Vets all over London. I've been doing home visits here for 15 years, so especially in North London, all the vets, they know of me, so I get a lot of them from that.
Yeah. Kirsty's asked if you use any quality of life questionnaires or frameworks that you advise for owners.
That's a really, really good question. I do prefer, my preference is probably the Ohio State University, their quality of life or end of life scale. It is actually available online. One of the reasons is I find purely one of the issues with quality of life scales is, what are you going to do with it? I often will hear, and I know a lot of practices have devised their own quality of life scales, but if someone says the number is this and it says this, that to me is not very meaningful. And I actually find, but that what they do is they will, so the issue with quality of life scales is, what are you doing about it? So it's how you use the information from that quality of life scale. So with the Ohio one, and they'll have a long detailed list of many, many factors that can come into assessing the quality of life of the animal. But then they'll also talk about simple things like, name 3 or 5 things that your pet likes to do, and when it's not doing those. And so you can actually, and I think it depends on, some people like, if somebody likes a big list and of the quality of life checks, they're great. But other people, if they don't like it, it's something that's more simple. Something more simple might be a better one to use. But it depends on what works for you, and actually what works in a meaningful way. Can it make a meaningful difference to how you manage your pet's quality of life, and does it make a meaningful difference to how you use it to make a decision for euthanasia? And I'm not a big fan of quality of life purely for the decision for euthanasia, because it's far more complex. I think they're good to monitor quality of life prior to the euthanasia and to look at things that need actioning, but not so much for the euthanasia decision.
Yeah, it's not a purely practical decision, is it? There's a big emotional element.
You can't put a number on to make that decision. Absolutely not. No.
We have a really great Good Day, Bad Day resource on CAM that's free. So that's a bit more of a basic one that people can just monitor how days are going. And sometimes that's a little bit more useful, sort of summarising.
Absolutely. I think people can get so overwhelmed emotionally with the caring, worry about their pet's illness, that sometimes keeping things a little bit simpler can actually be, easier for them to be engaged in and to take on board. So absolutely.
Yeah.
And
so I guess
owners know their pets the best by far. They know the pets.
Yeah. And what's different, one dog who doesn't want to eat one day, that might be normal for that dog. But if you've got a really, really boisterous Labrador who loves his food and he's really not wanting to eat, then that's a big, my dog, he could go a day without eating and he's fussy. So I wouldn't think anything of that. But you've got to know your dog as an individual, don't you, to know.
Absolutely. And another, just to put it in a nutshell sentence, can your dog do the things it likes to do? So, if it likes to eat, if it, what are its preferences, can it still engage in its preferences? And if it is a food motivated dog and it doesn't want to eat, people who have a food motivated dog and they don't eat, they know that's a problem. Now, but if there's a dog that's really, really fussy and it doesn't want to eat, that's usually less of a concern in itself.
Yeah.
But it's also the same for dogs that love to exercise, that love to run. When they can't do that, I would say that, and as much as one can adjust to their new way, the new normal, as much as one can adjust to that, we would think that a dog that loves to run, that can't do that anymore, they would probably feel more that emotional distress, as opposed to a dog that is not really exercise motivated. So when it has mobility issues, it's not going to emotionally affect it in the way of frustration as much. And then we go back to the emotional distress again.
Yeah. So leading on to this, I guess it's kind of important for us to talk about the actual practicalities of euthanasia, and particularly during COVID at the moment, things have changed quite a lot. And I know obviously you're providing a service that a lot of vets can't provide at the moment. Shall we talk a bit about how we go about the process of euthanasia and what people's options are?
Sure, of course. So at the moment, for euthanasia, the two main options are in clinic and also the home visit. Now, at the moment, a lot of veterinary practices, they're not able to offer that. I work alone, so I don't. So if I was unfortunately to contract COVID, I would have to self-isolate for 2 weeks. If somebody from a practice was to go into a home and inadvertently catch COVID, it's possible the whole practice would have to self-isolate, and that's just not possible. So it's totally, and I know that the general public find it really frustrating that they can't get a home visit from many practices. And I think just the feeling that I have, it's more likely to be from the corporates rather than the independents. Some independents may or may not be able to assist, but also we're at a time where most veterinary practices are busier than normal. There are a lot of some of their staff can't work. They may be in a highly vulnerable group category. Some small, with the a lot of the corporates. Some of the branch practices have had to close temporarily. So vets are under a lot of time pressure, and so even providing a home visit now for a lot of practices is really, really hard. But when we talk about, in the context of mobility issues, that's one of the things where people often really value the home visit for euthanasia, and it's totally understandable, especially if it's a big dog. But from the emotional point that there's no place like home, you would want, even for smaller dogs, people do prefer that. Naturally, I have my criteria, and they will be evolving even after today's new government announcements. So in general, obviously I have to ask if that nobody within the household has had COVID-like symptoms, any of the symptoms, or had a positive test or been in contact with a positive person within the past 14 days. The PPE is up until, and again, that will be changing. During the early days of lockdown, it was hard to get full PPE. But for the vulnerable, I do have further layers of PPE than for normal, but otherwise it is maintaining, I think one of the most important things is maintaining that social distance. And naturally, there's also gloves and face covering masks as well, go without saying, and disinfecting the things that we bring into the home. But it's for euthanasia. In dogs, I typically will use I sedate dogs just a little bit so they're calm and lying down, and the whole euthanasia goes more peacefully and smoothly in my experience. I tend to use the back leg where I place the vein cannula, and then I'll attach a extension tube, and depending on a number of circumstances, in the early days of lockdown, we had a 1 meter tube, so you're standing a good 6 feet away, and you can inject the euthanasia solution through that. So there are ways, and I do know, and some clinics will allow people in, and they're also doing it that way so they can maintain that social distance.
Yeah. So I can talk from a practice point of view. So my practice, we've been very lucky because of the way we're set up. We're able to have people in the building. We're just wearing PPE and they have to wear PPE. I have a screen in my room. I've got to be extra careful because I'm pregnant, so I've got extra things going on, screens and extra PPE, but we are able to have people in the room, and we can do euthanasias as we have traditionally with the vet and the owners together, and the owners have plenty of time with them, but we can't offer home visits. And I know other practices, they're not in position where they can have people in the building still, especially if they're the old traditional practices when they're in almost like a converted house. A lot of those don't have the space to allow people in and out, and so they are euthanizing in the car park, which there are some that are doing home visits, but they're very socially distanced, so even though the dog's at home, you're not actually able to be with them as the client because the vet's close to the dog, so that's tricky too. And I know that there are some where they just don't have the facilities to do that, and you have to drop the dog off the door, which is, I think, probably everybody, including the vet's, worst nightmare, because nobody wants that. We don't want to take that moment away from an owner who wants that moment. Slightly further on from that, I also think it's important to note that for some people, being there with their pet while the pet's being euthanized is really, really difficult, and it's not always the wrong decision to decide that actually you would rather just say goodbye and then for the vet and vet nurse to take them away. And we do that fairly frequently for clients who feel that's the best for them, especially if they're going to get very distressed and distress the dog. Sometimes it is more peaceful doing it that way for the dog as well. And I know there's a lot of things that go around on social media saying horrible things about people who decide to do that. And I actually think that it's a very, very individual decision how you want to have your pet euthanized. And if you want to have a home visit, then that's the way that we always want to facilitate. But maybe you want it in the clinic because you don't want to remember them at home, and that's okay too. However you want to do it is okay. And I think that's
absolutely, definitely okay. Certainly in the days where I did lots of when I did general home visits, and I'd had, only two, but not a lot, but out of a very, very high number. But that at the time of euthanasia, they said, Caroline, you've been coming to our home for years, but for this, we're going into the clinic because that's what we need to do. So, and that's totally, absolutely respect. And I think it's really important that we have to, the veterinarians, respect the client's wish. We don't know unless, they may reveal the reasons why, but often we don't know those reasons, and it's not to judge. And also, as Esme was saying, it's not for us to judge if a client chooses not to be with their pet, because you just don't know,
It's all very individual, isn't it? I think every pet's different and every person is different, and what is right for one person might not be right for the next person, and right for their pet as well. So I guess that's the difficult thing. I think you're in a lovely position in what you do, because we would love to be able to offer home visits, and it's just not doable in my practice. But you offer this amazing service so that people can have it done peacefully at home, and you aren't limited by the, as you say, being in a big practice with lots of people. You've just got to look after yourself. And COVID has changed that. I think euthanasia has always been a really difficult topic, but I feel like it's been added to now with COVID on top. It's made things more difficult. Would you agree?
Oh, absolutely. Absolutely. I think there's been so many emotional challenges with that people have had to deal with during this COVID pandemic. Euthanasia of the pets has been so hard for a lot of people. During the and we all know this. Our pets, they're often our rock, our solid. Most of us, we have our lives. There's a lot of change in our lives over the years, and for many people, our pets are the one constant in our lives, and they're certainly there to comfort us during difficult times. And the COVID pandemic has been really difficult for many people. So they've sought so much comfort from their pets, and they feel fortunate. For those who have been working from home or just staying their days at home, they've found that they've been really fortunate. They've been able to be with their pets, and if they have an illness, then they actually feel that they're able to even, they're glad they can better meet all their pets' needs. But after euthanasia, it's really, really, really hard. And I think it's harder for people now losing their pets. There's that extra layer. There's one, the people are at home a lot more, and you have a continual reminder everywhere at home. So that's really, really hard. And our pets, they're a great source of comfort during times of uncertainty. So it's been really, really, really tough. Really hard for so many reasons.
It actually leads on really nicely to a lady called Sue Rose has just commented saying that she's qualified today as an advanced pet bereavement counsellor, which is brilliant, and well done for doing that. So, and I think that is something important that we want to encourage. The Blue Cross do a free bereavement service, so you can call them and talk to them in a confidential manner, and they're all trained to deal with pet bereavement. And I think I think even now, even though we're in a country of animal lovers, it's still a little bit taboo, particularly for English people, to admit that they're having emotional distress. We are a little bit closed off. I think we're getting better. But
getting better.
I think people find it tough to talk about pet bereavement, and they feel embarrassed that they're still upset weeks and weeks after.
That's why they call pet loss a disenfranchised grief. And the disenfranchised grief, that refers to it, that a lot of society doesn't acknowledge it as real or valid. And we all know some of the unkind things that people will refer to as it's only a pet, and it's one of the things I actually will just when I'm speaking to my clients at the time of loss, and I say, seek out the people that you know that are supportive, and most of the ones who know your bond with your pet, and if they've had pets themselves, they'll understand. But people often will find after the loss of their pet that family members and friends who they thought would be really supportive aren't as supportive as they needed at this time. And I think that just goes to show that, as a society, we still have to recognize that pet loss is just can be just as intense as the loss of a close loved one. And I'm sure you've heard it as well, as may I hear so many times people who often say that they grieve more for the loss of their pets than they did for their parents. I think with our parents, for many people, it's a natural stage of life. They're older, and often they have really, really chronic long illnesses, and also if we're not living with our parents, you have that little bit of daily physical distance. Whereas with our pets, a lot of people will say they're like your babies. My pets are like my babies. They are. And so we have that type of, they're with us all the time. They're totally dependent on us. So we develop a really strong and a different, bond, a relationship bond. And that relationship bond, it's real. It's real. And as I say, our pets, their lives become totally intertwined into our lives. And sometimes the more the caring, the stronger the bond, the harder the loss.
Because you become so dependent on each other. It's so difficult. I always say, though, that those people who do make those really insensitive comments, that as hard as it is to take them, all you have to do is pity them, because they've clearly never had the relationship you've had. And
they don't understand. They don't understand exactly. Just reframe it as in,
when you've had that relationship with a dog, you'll never have another. You know what that is, and it's so special. There's no way to verbalize that, but it's so special. Or a cat, or any pet.
Or a cat.
Yeah.
Definitely.
Cat, I can see.
She's a Burmese, so of course it's a very loving kitty cat. Yeah.
Yeah, it's I think it's really difficult. I think you're absolutely right about trying to seek out peer support from people who are going to support you. We, as I mentioned already in this chat, we have Holly's Army, the owner advice forum, and that is there, and we deal with everything from my dog's on this medication. Is your dog on it? What does it do? To all the way up to I've lost my dog, and I'm struggling to cope with it, and the outpouring of support from people on the group is lovely.
It is, absolutely. And one of the benefits of these social media groups is they actually can be a huge source of support, and especially if people are during the COVID situation where a lot of people are indoors. You can't. One of the harder things for me in my euthanasias is it's just natural for me to hug a client at the end of the appointment, and you can't do that. So for a lot of people, hugs are, well, I'm a huggy person, so hugs are, you've got this wonderful healing, just support from a hug, and you can't do that. And a lot of people are locked in, they're at home. So these social media, there are a lot of networks, and there are more and more that are flourishing, and that provide support at this time. And absolutely, people find a lot of support in those. So it's a good plug for an extra plug for Holly's Army as well, because it is. You will find usually they're like-minded people on these, or there's someone who's been through that before. And once you've been through that, you can really, really know. You really have to, I think, experience pet loss to really know how hard it is.
Yeah. So just to bring things to a summary, really, what would you say your advice would be for somebody who's coming to that end stage decision with their pets, and they're trying to decide when the time is right?
Well, I think it's, as I had mentioned, it's you actually want to make use of as much of the support facilities networks that are available. So you will have obviously your veterinarian, and if in the case of for example mobility, you may also have an acupuncturist, a physiotherapist, and all of that. Seek support from them. There are support groups such as Holly's Army, and it's really important to help seek that support before loss, because we helping to prepare for the loss of the pet, and actually if the can help with the grieving after. So the more support you have, and we all know the grief starts before the loss, and it's called the anticipatory grief, the moment when it actually becomes clear that you're going to, your pet's not going to either survive the illness, or in the case often with mobility issues, that we're going to have to make that really, really difficult decision to euthanize our beloved pet. So it is really taking as much of the support networks, and just speaking to people, and everyone will have their own different perspective, and someone else's perspective won't be right for you. But the more that you seek out and reach out, you'll hopefully find someone, and you can identify with what they're saying and their advice, because there'd be a lot of advice that can be very, very good advice, but if you don't identify with it, it's just not helpful. So if you're able to, and also with your the professional support, hopefully you have someone who's able to give advice that you can identify with, and don't be afraid to ask for further advice or further support.
Yeah, absolutely. That's such great advice. Caroline, thank you so much for joining us tonight.
You're very welcome.
It's such a difficult topic to discuss, I think, from an emotional point of view, and
really important topic.
Yeah,
I think it's the one that is probably under discussed, because it's regarded as such a difficult topic, and I know that a lot of it find it difficult to talk about, and also there's time pressures, because these are often they're lengthy conversations, and also they're emotional conversations, and some people find that hard, but it's a really, really important conversation, and we need to come back and talk more about this another time.
We definitely do, and we'd be really, really, really happy if you came and spoke on cam again for us.
I'd love to. Thank you.
So thank you very much, and thank you everyone. I hope it's been helpful this evening. I will put a link to Caroline's website, so if you are in the London area and it might be that you're coming to that sort of decision, maybe you could reach out to Caroline and she might be able to help you. And hopefully we'll see you on here again soon, Caroline.
Okay. All right then. Okay. Bye.
Thanks everybody. Bye.